And more cities in the United Kingdom are facing tough new COVID-19 restrictions. The Health Secretary, Matt Hancock, imposed strict new rules on hotspots across England. But the situation in Greater Manchester and Lancashire is in chaos after the government and local leaders failed to reach a consensus. Londoners will be plunged into a tougher lockdown at the weekend, along with Essex, Elmbridge, Barrow in Furness, York, North East Derbyshire, Chesterfield, and with a ban on meeting people they don't live with indoors. There are concerns over what these new restrictions will cost residents, with Labour has called for a circuit breaker lockdown, with a government accused of putting thousands of lives at risk. Now, joining me to discuss this is a global affairs analyst, James Woods. All right, James, thanks for joining in. It's a tough situation London is facing right now, thanks to the coronavirus. What do you make of this?
Well, it's a very difficult situation. I'm bearing in mind how the pandemic has impacted not only London, but the world generally, with over 1 million deaths. And we're looking at London with a total death rate of 43,000, the UK, I should say, 43,000. Focusing on London, we're just looking at the past day where we had almost 20,000 cases. So the significance of this pandemic is really big. It's really affecting the way of life. So looking at this restrictions the government has put in place, moving London from a medium level to a high level, absolutely, this is going to have an impact on the way of lives for people. Those from low income households, those facing challenges, those on job losses, the youth in particular. So there's going to be very major challenges on that.
This seems to be taking London back to how it was at the early start of the pandemic, where there was a major lockdown and life was on standstill. London seems to be going back there. What are the preparations put in place for this, for people and for the period of a lockdown, and even the government?
I think for myself, I'm one of the people that believes particularly in following the science. So I'm one of the few people that I think, well, I shouldn't say one of the few people, the majority of the people, according to a YouGov poll, about 68% of people interviewed highlighted that they believe that a more national lockdown was more required to follow the science, that in the short term, there'll be major impacts, but long term, the moment we are able to get the health control, because the health itself, health aspect and the economic aspect, they're interlinked. You can't separate them. They're all one and the same. At the moment, the packages I am seeing that the government is putting into place, in my own personal opinion, I think we're going to find major challenges. The economy is already retracting. We've already seen that from February to April, there was about a 20-25% contraction in the UK economy. That's now with these regional lockdowns, they should serve better. But what they're doing, I should say, is more or less temporary halting a situation. But the numbers are still rising. As you may have noticed today, they were supposed to put Manchester in the top tier. Local authorities from Manchester were mentioning that we've already been under these restrictions, but the numbers are still rising. So I'm also going in the same terms as what Starmer was saying, what the Mayor of London, Sadiq Khan, was saying, that there needs to be stronger measures put into place to really control this virus. The moment we control the virus, that is when the economy grows, the health grows. As of now, I think nothing is really changing. That is in my own personal opinion.
Why do you think it's getting worse? Why do you think nothing is changing? Why are the numbers on the rise, on a steady rise?
I think at some point we have to understand how these rules, how clear are these rules. London has moved to this high level where it's meaning that no household mixing indoors, the rule of 6 applies outdoors, pubs and restaurants to shut at 10 p.m. But how are these actually really being enforced? Because there's a lot of people who are flouting these rules and regulations. So if you're flouting these rules and regulations, no matter what you do, the numbers are still going to rise. I think there needs to be a more sort of discipline in individuals as ourselves. We also need to not only look at government, what government is saying. As individuals, we need to see how best can we protect. But now the way the world has gone, we're now moving into this digital world. So I think at this time, I think it's also high time the government actually looks at investing heavily in the digital infrastructure and start creating more opportunities through that platform. That's I think the way I see it being curtailed to some extent. But as I said, as of now, we have to follow the science. The virus is here, and it's going to impact a lot of lives going forward.
You say more opportunities and more platforms. What do you mean by that?
As we're saying that because now we're in a society whereby our way of living significantly changed. The way of life today it's more or less we're living in isolation. We're living in smaller circles. Most people are working from home. So I think the deeper need to actually really invest in this infrastructure, which makes that a sort of norm for society, that society can actually be able to operate without not at that full capacity, but incomes are not being really affected. But of course, that will affect the service sector. I'm not a key policymaker in these areas, but that's just my own personal ideas of certain areas where we can limit the impact in the short term, whilst bigger plans are being strategized for going forward.
So the mayor has said that he warns that it will be a difficult winter ahead. How prepared are they, and how are people taking this?
To be honest with you, to say how prepared the government is, as of now, let's also be really honest. The government has tried different mechanisms, and numbers are still rising. So we can see that methods of the past haven't really had a very big impact. So to answer how prepared are they, only time would tell how prepared they are. But what we can see is that the NHS itself is going to be overwhelmed. That is one thing we can see. And we have already recent examples, not only in London, we can look outside of London in Liverpool, for example, where about 95% of intensive care unit beds or so were being taken, and half of those are being filled by patients with COVID symptoms. And away from that, we're seeing people afraid to go to hospitals. We've had an increase in heart attacks where people are afraid to go to hospitals because of COVID. So to answer that question, only time will tell as to how prepared it is. But all we can do as of now is abide by the regulations. Westminster itself is sovereign in the decisions it makes. They can work with the local authorities to curtail the spread, but they are sovereign. If they want to impose tighter restrictions, they can. But at this point, it's about also citizens working together with the government, supporting the government. So only time will really tell how prepared the government is.
All right, before I let you go, what do you make of the trials, the vaccine trials going on? And I mean, London being what it is now, looks desperate to have it, to curb the situation going on there now.
I think looking at the issues of trials, we've heard a number of stories around trials in different countries, from Russia to other places being tried in Africa or so. The trials itself will take time. We all know that the only time we can really say that there is significant progress made, we should be looking at more or less towards the end of next year for something significant to really take place. This stuff cannot just be fast-tracked, but there is a very big need for these trials to actually be effective and impacting the lives of people to curtail the spread of COVID. But in the meantime, whilst we're waiting for the trials, I think it is up to us as individuals to follow the rules that are being set by the World Health Organization. Let's practice our social distancing. Let's sanitize. Let's be safe. Let's not flout the rules. I know it's tempting to flout the rules, but as they say, prevention is the best way to actually avoid being affected. So we have to prevent ourselves.
James Wood, thank you so much for sharing your thoughts in this regard. We appreciate it. Keep it safe. Take good care.